The previous business, we get a motion to approve the previous meeting minutes by Brian, second by Gary. Number one, local law number S for 2016. Local law of the County of Albany, New York, regulating the use of polystyrene foam disposable food serviceware and requiring the use of biodegradable and compostable food serviceware by food service establishments in Albany County by amending local law A for 2012 as adopted November 12, 2013.
Chris, can I ask you a question?
Yeah.
Is this different from the one we got?
Why was he there?
Yes.
So we will be having a law committee meeting before the public hearing.
Oh.
We'll be able to approve this one, but it'll have to be a handout of the public hearing, obviously.
Okay.
All right? Because we have the one Monday. We have the one the Monday before the public hearing next month. We have the law.
Yes, okay, yeah, okay. So you want me to scroll this quickly? I think it should change what it says.
I just want to clarify.
Oh, yeah, okay. So this is,
Can I just, this is a new one that we just received now?
I updated this at 3:30 this afternoon.
Oh, okay.
So they didn't receive it in time. to
Okay, so
print it out.
this is what we're talking about, this one right here.
Oh,
It's-
it is?
That is the correct one, yes.
Oh.
And,
I didn't get
We
it.
just got handouts, yeah, okay.
Oh, okay.
Okay.
So, yeah.
So Chris, I mean, I hate to quote you, but you want me to look at this now that it's been updated since 3:30?
I updated it, yeah.
Yeah.
Sorry. Well, I can tell you what I had. So
Yeah,
I
tell
I
us.
Okay,
had
yeah.
a meeting with the commissioner from the health department, and they had some suggestions that they thought would make it easier. They did say that they can do this, but they wanted it to make clear that it would only apply to those facilities that the county health department regulates. For example, Gary, you say sometimes Ag and Markets has jurisdiction over those issues. We can't preempt that state law to go into grocery stores. So they suggested changing the language in the definition of food service establishment. So we changed it to permitted by the Albany County Department of Health, which is their jurisdiction to inspect those facilities. So it gets around the jurisdictional issue with what facilities this would and would not apply to. They said that it will not cost any additional amount of money since they already do this for the chains. And since it's only going to apply to the places they already go to, they don't have to go to any new restaurants. So I made that change at their request.
But they're in the chains too.
Yes, they're already in the chains. They're,
I mean, they're in Price Chopper. We go to Price Chopper for weights and measures and check on the pricing law.
yeah, they specifically suggested this language permitted, so.
So the Price Chopper Deli is the oversight is in Ag and Markets and not health.
The hot foods to go.
Oh,
The scales are Albany County. The hot foods, those section is, Ag and Markets.
okay.
So this is their language here that's been inserted into the definition that they suggested. Then the other thing that we did, there was.
Chris, can you just talk about that a minute?
Yeah,
Because
sure.
I'm uncomfortable with giving supermarket chains an exemption on this. Pretty much is what you're doing. And making a small mom and pop restaurant in the corner comply with it,
Well, I'm gonna get to that,
you
Gary.
know? But, you know what I'm saying? We are in Price Choppers and Hannaford's anyway, and Sharp Cutters. So there's no big deal for, instead of the health department looking at that and overseeing, just looking to make sure they're not using foam, but have the weights and measure guys just look.
Yeah, wherever they go to inspect things, they're gonna be looking for
But they
this.
don't inspect. Weights and measure just checks the scales.
Oh, all right, well, I guess I can
And they do
say,
the item pricing law. So we are in those stores. Health department's not in it, but Albany County's in it.
So who's going in and inspecting Price Chopper's Hot Foods Deli?
Ag and Markets. New York
So
State Ag and
they're
Markets.
inspecting it from a sanitary cleanliness compliance
State.
with. Okay. So someone's doing it.
Yeah.
Which I believe they preempt us from
yeah,
doing
we
our-
can't touch that.
What about like McDonald's and Burger King, that stuff? They-
We already,
They're already.
they're
They're
already
already covered.
prohibited, yep, because they're chains. So we're looking to expand this to all restaurants in the county that the Department of Health has jurisdiction over. Gary's made the point that it should be anything that we have jurisdiction over, so I should go and ask about it.
Yeah,
I made this change.
We're there anyway.
Yes.
I can understand what you're trying to say, but
But right, the chicken wings, you're getting at the little hot food thing, the
Yeah.
Price Chopper.
Yeah.
You would still be able to fill up the styrofoam thing full of chicken wings.
Well, I don't, I didn't get into it with them, with the health.
Price
department.
Chopper doesn't use foam.
Yeah,
Well, whatever, I mean.
Yeah, but I'm just saying,
Yeah.
what,
I mean, I can go and ask them. I mean, this was their language, they suggested this change, they wanted this change, so I made the change on Friday and Saturday. But, I can go and ask them what this weights and measures thing.
yeah, it's, if they had a problem with weights and measures in there, or chains, that they can just check and see if they're using foam, that's all.
So the other thing we did too is there was some concern about not-for-profits that use styrofoam and whether we should or should not exempt them based on whether or not they can afford to do it. So the Department of Health came up with an idea. They said when, I think it was your bill, Gary, did you sponsor the smoking ban?
Yeah.
So I guess in that you had a waiver provision, a hardship waiver.
Right.
So they emailed me a copy of the smoking ban in restaurants bill, your bill, and I took the waiver language out of that and I pumped it into this. So this, there's no reason, in my opinion, to reinvent the wheel. So this is how, I guess, we did it before the state banned smoking in restaurants. So I took that
And
waiver
by the way, the
language.
state put that waiver in too.
Yep, and I made it a new section 6, and that language is out of the smoking ban bill. Those are the two big changes that I discussed with the Department of Health. I did ask them to see if the Board of Health would weigh in on this. The Board of Health only meets quarterly, so they're gonna meet in December, and I'll make an appearance at that meeting with hopefully one of the other sponsors, and see if we can get a letter from them like we did 3 years ago when we did the initial chain ban. And no, that's not gonna happen now for a month and a half. So I was hoping to move the public hearing out of the law committee meeting, or on Monday, and I'm hoping we can move the public hearing notice out of the health department, schedule the public hearing. That way we can get the input while I'm still waiting for the Board of Health and take the, whatever testimony we get, and bring it down and present to them. So that's what I'd like now, table the local law, move out the public hearing notice.
Any questions for Chris on the local law itself before we table it?
Can I ask one more question? The silverware piece of it, that to me, I mean, there are definitely cheap alternatives to styrofoam. There's less cheap alternatives to plasticware kind of thing. Is that your sense? I mean, you have the waiver language, but if you have a small, that's a real, I think that's a real game changer in a lot of ways.
What exactly are you talking about, Joanne?
The way the disposable food service thing, this, correct me if I'm wrong, but you're saying that they have to use a suitable alternative product that's biodegradable or compostable.
That's the current law for chains.
Oh, okay, so that all it
chains.
is getting rid of the chain.
We're expanding it to
to the
everywhere.
net. Okay.
Well, assuming it would pass, that it would, and that was the intent 3 years ago. We did this thing, we talked about it for like 2 years,
Okay.
and then we went back and forth about whether we should do a blanket bill or just start small and then move
Okay.
big. And then when the county executive signed it, actually signed it in Bethlehem, he had said, I'm pretty sure he said he supported a full one in
Okay.
his little
So that was
VPN.
intentional though?
Yeah.
Okay.
Yep. So that's what we're doing now. It's been 3 years, and there's a 6-month stay of implementation on it,
Okay.
too, to give the stores the ability to, use down their current stock.
Right.
And then if they really feel they need it, they can apply for the waiver.
Okay. Can you put me on it?
Yeah, sure. All right. Mark?
Yes, they say they have to have a suitable alternative. What are those suitable alternatives?
So the actual waiver would be developed by the Department of Health, and they emailed me a copy of the current waiver application that we're using for the smoking ban. So I envision that they'll use the same waiver. I just didn't attach it.
No, I mean, if they're going to use something other than styrofoam, what would it be?
Oh, whatever all these chains are using now. Some are using recyclable.
Lava's using recyclable.
Cardboard.
Some are using cardboard, some are
There's a ton
using
of
like
them.
a similar type of styrofoam material. It's not styrofoam, but it's recyclable, like Dunkin' Donuts. They use this now, so.
Okay, so there's a, what has their response been? Has it cost them more money? The folks that are using this new kind of,
Well, I can't speak for the department. I mean, I don't go into these facilities, but I had this lengthy meeting with the department. I don't know if the commissioner's here or not, but she said they've had no problems with the enforcement piece, but they only had 2 people that they had to fine since it's been enforced. One was Sonic, and they paid the fine. And then there was another fast food restaurant that I think complied and we didn't have to fine them. Everybody, they haven't had a problem with anybody else.
okay.
I think the pricing is
Any
coming
other questions
way
for Chris before we
down
table
on
this? Hearing none, can I get a motion to table? Motion by Gary, second by Joanne, all in favor, any opposed? This is obviously going to go to public hearing, as you mentioned, so we'll look at this again next month after the
Chris,
public hearing.
how come I asked one of the sponsors?
Oh, yeah, Gary, too. You might, Gary, I got a lot of things going
Under
on.
current business, number 2, resolution for number 457, public hearing of proposed local law amendment act for 2016.
Bless you.
Second. Scheduled for November 22nd. Any motion? By Gary, second by Brian, all in favor, any opposed? Number 3, authorizing agreement with the psychiatric group of Albany regarding the provision of psychiatric services. Giordano?
Good evening, Mr. Chairman. So this is a request to enter into a contract renewal with the medical prescribing professionals in our department, the Psychiatric Group of Albany. This is a 3-year contract that's been renewed a number of times over the years, and we're asking to renew it starting January 1st once again.
Right?
Were there any other proposers for the contract?
No, it didn't go to RFP. We've been advised by purchasing and Department of Law that as a medical provider, as long as we didn't have any problems with them, the continuity of care with our patients was the thing that guided us, and we did not RFP at this time. It was RFP'd 2 or 3 iterations ago, and there were a number of responders, but this time it didn't go to RFP.
How many agencies do you think would have been interested in responding if this had gone out to RFP?
Well, I can only say that, finding psychiatrists is a big challenge, and keeping them is a big challenge. I don't know of any other psychiatric group in town, quite frankly. Doesn't mean there aren't any, but that would have been interested in taking on this challenge. So I really don't know how to answer that. The last time there were 2 or 3, some from out of the area that were thinking of coming in, but again, from my perspective, one of the strengths of this operation is our multiple sites: jail, clinic, mental health, substance abuse, community. It's all the same prescribers, and since we have a chronic population, many of them have been treated by their doctors for many years, and that's why we would argue that continuity of care is a prime decision.
Looks like this agency's been doing it for 23 years.
Dr. Paul Tier is the medical director, and he puts together his team. The team has changed over the years. Right now there are 12 prescribers that he has, but yes, this group under his auspice has been 23 years.
Wanda, you have a question?
Yes, I just want to get something clear. All right, so this is 1.5 annually,
Yes, it is.
and this is a 3-year?
Yes.
Okay, so can you tell me, on an average, how many patients are seen,
Sure.
annually?
Sure.
Okay.
We're just finishing our annual report, which we can share soon, but these numbers don't change that much year to year. In our mental health clinic downtown, we have a constant clientele of about 850 chronically mentally ill folks. We have a substance abuse clinic which has about 50 folks. Our jail population is variable, but last year we saw over 2,000 inmates.
Is
in
this
one-
part of the jail? I thought the jail was separate.
No, they're at the jail too.
That's part of this?
Yeah, and so the number of patients seen exceeds 1,000, 1,500, maybe even approaches 2,000 over the course of the year.
So, okay, so I heard you say 800 and then 50 and then 2,000.
Right. So we have in our downtown clinic we have a census right now of about 850. We have a substance abuse clinic with a census of about 50, so that's 900. And then the variable jail population, it takes us over 1,000 annually very easily.
And how many physicians is this? How
So
many?
it's 6 physicians and 5 psychiatric nurse practitioners. All of them are licensed to prescribe medications. So it's essentially a group of 11 medical professionals.
That sees 3,000 people a year?
Well, it's over a year, so we have 40 hours of psychiatric coverage at our jail, and we have multiple people at our clinic for 40 hours, and we see it's a high-volume operation.
Yeah.
Yes, it is.
How many psychiatrists do they employ and how many nurse practitioners?
It's
or other professionals?
six physicians and 5 nurse practitioners right now.
Okay.
And they all are licensed to prescribe.
How much of the jail, of that 1.5 million, would you say would be jails?
Well, I could tell you the factors that would go into the calculation, although I haven't done the calculation. We pledge 40 hours of time up there. The doctors get a higher hourly rate than the nurse practitioners, and we mix them to cover each day 8 hours a day. So it's the doctor rate is, it's not cheap. It's 100 plus an hour times 40, and
Whatever that is, it is. I just
Well, I'm just
think
saying-
that the jail should be separate from the health department.
well, mental health department.
Well, with the mental health department. It's just for budgetary purposes.
Well, we have a unit up there,
Yeah.
and we have 7 social workers, full-time, 40 hours of psychiatry, and we've always operated as a satellite. We're licensed by the Office of Mental Health to do a jail satellite. So we've always, not that we always have to, but we always have operated this way, and our budget has been separate.
Now, do you have any of these clients that have insurance that we can bill?
We bill everybody that we can.
And how much would you say that is out of 1,000?
Well, I will tell you that a big change this year, July 1st, was everything went to managed care. So even our Medicaid patients are now in Medicaid managed care. Those are all reimbursable services at varying rates depending on what the service is. Very few people come in who are indigent, but if they are, we do sliding scale, but we try not to give it away.
Oh, no, I'm just saying, not every,
We bill for what we can.
There's a lot of people that we service. Unfortunately, at the jail, we can't bill anybody,
That's correct.
but there might be a backdoor way for us to find some extra revenues if it can be billed through the health department or mental health department.
Right, well, many of the mentally ill people in jail end up coming back to our clinic, and that's where the doctor continuity of care is positive. And so we will, if they come back to our clinic, we'll bill the managed care companies that way.
So do you know how much you get back from Medicaid for that population?
I don't, each service has its own billing fee, and depending on what we're providing, so I don't have the number for you. I mean, I could get that. But we know exactly, if a 30-minute visit, a 45-minute visit with a social worker or a doctor, medication or not, group therapy versus individual, every one of those has its own medical rate.
Right. Can I ask one more follow-up?
Sure.
Assuming that the psychiatric group of Albany, this isn't their only contract, right? Like they must have contracts with other healthcare providers, other managed care plans, other.
Well, I don't know their business, quite frankly. I know that some of them, there are a few of the medical professionals are with us full-time. There are a number of them who have a private practice, who are working in a nursing home for a few hours a week, but I don't know that if Dr. Qualtier, as the medical director, I don't know that he has any other contract, quite frankly.
Because, if you think about the, 9 psychiatrists and 15 nurse practitioners?
6 and 5.
6 and 5. Yep.
Okay, so now that's even less of a patient-provider ratio for a very needy population.
Right.
Because it means they're not just servicing the 1,000 or 2 or
Right.
whatever.
Well, every one of these people has a social worker, and those social workers will see people, once a week, twice a day if need be. The doctors are the medical consultants, so typically a new patient, may be seen every week, but at a certain point, some of these doctors carry caseloads just like our physicians do of 100, 200 patients. They see them every 3 months, as long as they're stable on, so it's much like a general medical practice, and the caseloads are high.
Wanda?
Okay, so, I have two questions. I heard you say that, the inmates that are seen out at Baldwin County,
Yes,
at the jail, are they automatically covered when they come under the county, the jail?
covered in what sense?
In the sense that Jerry asked about being able to get a return on whether or not anybody has insurance or
Yeah,
But when someone comes into the jail, are they automatically,
there's nothing that we provide at the jail is reimbursable.
oh?
We get
okay.
money from OMH, we get money from the New York State Office of Mental Health to support a forensic clinic. If you have Medicaid coming in, it gets suspended. If you have Medicaid going out, it gets reactivated. But during the time inside, we're not able to bill for that.
Okay, and my second question is this: in listening to some of your comments, you did state that if someone had been at the jail, then they would be covered down at the clinic.
Right,
Okay,
if
so
they
then they
needed,
change-
if that follow-up.
So out of the 2,000 that are out at the jail, the 800 that you just, how many would you say?
Yeah, all right, so the 2,000 is annual. Right now, we have about 135 active mentally ill inmate patients. So that's our caseload right now. Over the course of the year, that rises because sometimes we have people for the whole year, sometimes we have people for a day or two. So yes, we try to hook those folks up to treatment afterwards, and we try to bring them back into our service if we're able to.
So they become part of the 800 or 850 or
If
however you get there?
we hope that they do, yes. Some of them are from other counties and they go back to where but if they're Albany County and they need follow-up care, we'll bring them back into our service.
Chairman, Doctor, they get service, when they're in the jail, they're getting service without reimbursement. They get out of jail, they still need the mental health
Many of them
services.
do. Some of
How do
them-
they afford it? They just got out of jail. Are they just Medicaid?
We work very closely with all of the players here. There's Medicaid enrollments that are happening while people are incarcerated. DSS helps us on the way when people come out. The idea is to try to make this as seamless as possible. So although sometimes the release is not predictable, we try to make it as best as we can to coordinate with a provider in town, with DSS. Of course, it's dependent a lot on the courts and getting who gets bailed out, but yeah.
How is Obamacare affecting Medicaid reimbursement?
Completely related to the resolution, is it?
Well, that's a great question. I don't know that I could answer that.
Because
without-
instead of going on Medicaid, they can go on Obamacare because they don't have, they're indigent.
People are
And they get
enrolled.
insurance.
People are enrolled.
So they have insurance as
Yes.
opposed to someone who's on Medicaid who doesn't
Yeah.
have insurance and is
Yes,
reimbursed.
people are enrolled.
So how does that affect what you might be able to pull away in terms of reimbursement?
We'll bill whatever insurance someone has. And there are a lot of forces working together to try to get people enrolled. So there are navigators in the correctional facility, there's case managers in the community. If you don't have it, we're going to try to get it for you. And if they're eligible for Medicaid, so be it. If they can get on to an Obamacare plan.
So if someone's indigent and on Obamacare versus someone who's on Medicaid, which are the reimbursements the same?
Well, if they're indigent, they're gonna be on Medicaid, they're not gonna be on.
No, can't they get Obamacare?
No.
Right, so I actually was using indigent to describe
No, they're
someone who had
totally
nothing,
separate.
because
If you're
we see
indigent,
people
you
who have
wouldn't
nothing.
get
And
Obamacare.
it's pre-Medicaid. People living under the bridge who don't go to DSS ever. We'll try to get $1 from them if we can, because it's important to kind of pay for the services you're getting. That's to me what indigent is. There are people who are very low income who are on Medicaid, and there are people who can't get on Medicaid but are able to get into one of these plans.
Yeah.
There's a lot of activity going on in terms of enrollment. And again, we try to make it seamless coming out of the correctional facility whenever possible.
Thanks, Doctor. Is there any other questions specific to the agreement? Hearing none, can I get a motion to approve? By Gary, second by Joanne. All in favor?
Aye.
Aye.
Any opposed?
I'm not opposed, I'm opposed to that recommendation. I have no question about PGA's quality and the services they provided, and I understand the continuity of care argument. I think all professional services should go out for RFP. I think we should see who else is out there, if there's any other groups that might be able to do as good or better a job. And continuity of care can be a factor in whether we go with PGA for another contract again. But there are other groups out there, and I think we potentially shortchange our patients if we don't see what other opportunities are out there.
I agree with you in the most part, except for when it comes to maybe psychiatric services, because maybe there's some specific, benefit to actually providing that continuity of care that you talk about with, with these patients that come back to us time and time again, so.
I agree, and I think in a formal RFP process, that would be something which would go to PGA's favor, but for all we know, there may be 3 or 4 other utterly dynamite groups out there that went around 5 or 6 years ago.
Okay, motion to adjourn?
Thank you very much.
Thank you, Doctor.